In this podcast, I'm going to be talking about the macro hairline design. There are two types of hairline designs that are part of achieving natural results. Briefly, I've discussed some of the elements of the micro hairline design in the past in a different podcast. In that podcast, the micro hairline is essentially using how the graft sites are made to create an undulating pattern that looks natural. In other words, how the doctor, the surgeon, that is I, would make recipient sites to make the sites, angles, distribution appear natural. But the very beginning of a procedure, the hairline position and shape is defined but with a simple marking pen or eyebrow pencil to begin with, and that hairline is known as the macro hairline. So the macro, which obviously in Greek means large, is the general position and shape of a hairline, and that is what is important in the design process as a fundamental first step to achieving a natural result. So I want to talk about some of the principles for macro hairline design. The first part of this is the hairline has to not go beyond what is called the lateral canthus. So the lateral canthus is the outer part of the eye. So if you took a pencil and move it straight up from the outer part of the eye, the hairline cannot go beyond outside of that. In other words, toward the ear. If it does do that, it will look unnatural. If you think about a comb over where someone takes hair from the outer part of their scalp and moves it to the midline, that also looks weird because they're taking hair that is lateral or outside of the canthus and brushing it over to the middle. That just doesn't look right because it doesn't exist in nature. So when you're designing a hairline, the outer part of the hairline cannot be farther out than this lateral canthal position. The second point is that the central point of the hairline cannot be below what's called a shingle point. So let's put it this way. If you think about the forehead, that's on the vertical plane of the scalp. The horizontal plane of the scalp is behind that. If you put your fingers together and create like a right angle, the intersection where it goes from the vertical scalp, that is the forehead, to the horizontal scalp, that is the lowest acceptable point. So if you make a point that's below that, the hairline will not look right because it doesn't exist in nature. Now, there's a few people, I have actually a colleague of mine in St. Louis has such a low hairline that his hairline actually goes over that principle. But when someone is getting hairline reconstruction, you don't want to do that because they're already balding and it'll look really weird. The next point is that when you connect these 3 points, is that from the side view, those lateral points have to be either at the same height or higher. It cannot be lower. If you actually make those lateral points lower, then it'll look like a female hairline. And again, yes, there are some men that actually have that type of hairline shape and they don't look feminine or transgender, but it's still a shape that is not good to design because it won't look quite right in the majority of cases. And when I teach hairline design at my St. Louis course, I talk constantly about, I watch my students draw those lines and they don't look right, and I make a comment about why they don't look right, and it usually has to do with the fact that they've made a female hairline inadvertently. So it's very important that lateral line, when it goes across, not slope downwards. The other point of, nowadays a lot of hair pieces look very, very natural, and you'll be surprised, but the biggest issue with them right now is that the temporal point, in other words, the hair that does fall outside of the lateral canthus, that is the temporal hair. If it's too far receded and you have a hairline, the central hairline goes too far forward, that also doesn't look right, and it has to look balanced. So the temporal point, temporal position of hair, and that middle section of the hairline have to be balanced. Otherwise, they won't look natural. There are a lot of other small points in terms of hairline design. For example, if you are trying to put a very aggressive frontal hairline position with an aggressive temporal point, and that first of all eats up way too many grafts in some patients that have excessive baldness, but it may look what I call front heavy. So when you ultimately design it, even though the hairline quote unquote looks natural, no person in nature has a huge abundance of hair in the front and then nothing in the mid-scalp and the back. So it has to follow what's called a Norwood pattern. It has to follow a natural shape. So hopefully this short podcast about just general principles on macro hairline design can be helpful for you to understand the things that I go through when I think about making a hairline design for you.